Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Hello, everyone. This is Bucci Nita, and welcome back to the Skin Sync podcast. I am so pleased and honored to be here today with my colleague with Elevate-Derm Alliance, Lisa Weiss, and we're going to talk about some viral trends in skincare. From beef tallow to salmon sperm, there's a ton of things out there that are moving faster than the research can keep up with. So let's talk about what patients are actually using and what actually has some evidence to back it up. So Lisa, welcome to the podcast.
Thank you so much. I'm so happy to be here and talk about these myths or possibly facts that we hear on
Yes.
social media.
This is going to be fun because I think a lot of us are encountering this every single day in clinic where we're having to debunk something or treat a patient who's having consequences of some of these therapies they're learning about on TikTok. So let's kind of dive into trend number one, beef tallow. This has been huge over the last couple of years, and it doesn't seem like it's going anywhere. What's your experience with it?
I think I've heard more about beef tallow in the last year than I've heard about anything. I've seen billboards about how beef tallow is the new
Oh
sunscreen. I've
my. Okay.
patients come in with jars of beef tallow telling me it's the greatest moisturizer they've ever used. I I I, I can't hear more about beef tallow than I already am.
Okay, well, maybe there's something to back it up. So let's talk about what beef tallow actually is, because I did not know initially. Apparently, beef tallow is essentially beef fat. It is bioidentical to sebum, according to social media, and it's got ancestral properties to it. It heals eczema and acne and everything you can possibly think of. But what is the reality of beef tallow, Lisa?
Well, the reality is I'm not quite sure it does what it's claiming to do. So beef tallow actually is rendered animal fat. So if you want to take something that they're making sound glamorous and break it down to what it actually is, that bioidentical to sebum product is actually rendered animal fat. It's really just primarily triglycerides. It has oleic, palmitic, and stearic acid. And it has a small amount of fat soluble vitamins, so it has some qualities that could be good for the skin, but it tends to be fairly occlusive. So it's interesting to me that it's being presented as something that is healing to acne
Right.
because we don't typically think of occlusive things as acne healing.
And it may have some benefit when it comes to really dry skin or obviously, maybe some eczema patients who are having issues with dryness, having issues with transepidermal water loss. So we do like occlusive agents, but again, it's really not the most appropriate product to use. And oftentimes at high concentrations, it can actually disrupt the skin barrier. So it's not really the product that you want for patients with acne or for those with sensitive skin either.
Right. And, I did a good amount of research on this to see if there really was scientific research in beef tallow. And it does not replicate human sebum. It's not the same. It doesn't have those wax esters and it doesn't have squalene. And what was really interesting to me is there's not any high quality clinical trials on topical beef tallow. And there are no direct head to head studies with beef tallow and any of our good occlusive products that we use daily in dermatology.
So, like most things on social media, unfortunately, there's little data to back it up. And oftentimes, we have really good things available to us. Even plain petrolatum does a great job as an occlusive for patients and doesn't seem to cause these barrier issues. So really, there's a lot out there that can still be very effective, but unfortunately, it's not as trendy as beef tallow.
I was about to say petrolatum is not as sexy as beef tallow
Right.
these days.
Petrolatum is also relatively inexpensive compared to beef tallow, which can cost you anywhere from $10 a bottle to $40 plus. I have a lot of patients who go to the local farmer's market or to the local farm, and they'll actually go and purchase it from there. So I hope
I'm gonna
this
stick
trend,
with my
your petrolatum,
I'm gonna stick with my
I
petrolatum. It's
agree.
inexpensive and it works incredibly well, and we have lots of high quality data about it.
Right. And I've actually seen several patients, I can count four over the last few months. One had a flare of her rosacea after switching to beef tallow as a moisturizer. One had a flare of her acne, and she was very confused as to why this happened. And I had to explain it's clogging up all your pores. But yeah, acne breakout. And then I had two cases, one with periocular dermatitis, the other with perioral dermatitis, really significant cases, like not mild at all, as a result of using beef tallow as their exclusive moisturizer. So It's not without consequence. I really think we should be advising our patients. Otherwise, it's not a benign a product to use on the skin.
I think we also have to just worry about the hormonal exposure,
Right.
remembering that beef has hormones in it and that you are potentially rubbing exogenous beef hormones all over your body. So, not just that it's going to cause your acne, and I agree with you. I've seen multiple patients with acne and perioral dermatitis from this, but that you're potentially exposing yourself to exogenous hormones that your body doesn't need.
Right. I think we should lay it out like that for them. Like, you're putting beef hormone on your skin, so let's not do that.
It's not quite as sexy when you
No.
talk about it like beef
Not at
hormone.
all, not at all. Alright, so let's move on to trend number 2. Another huge one the last several years, I would say, is Korean skincare, and also glass skin, which kinda came from this great Korean skincare world. So what does that actually mean? What is glass skin? Why are patients trying to achieve this? And what do you have to do to achieve this glass skin? And then is it real? Is it not?
You know, I think the Koreans are onto something. They all have gorgeous, gorgeous
They
skin.
really do. They really, truly do. Yes.
Glass skin refers to that smooth, luminous, reflective skin. And they have a really big focus on hydration, gentle exfoliation, and true barrier support. And I think the reason those of us in dermatology really love Korean skincare is we all believe in those things too. I
Right.
mean, that's what we're all talking about all the time. The one thing that Korean skincare has that we don't necessarily do, though, is it's often 7 to 10 steps in
Right.
Korean skincare. And I don't know about you, but I don't have time for 7 to 10 steps in my morning or evening routine.
Absolutely not. I'm lucky to do 2 or 3. And I mean, really, it starts to become not only time consuming, but now we're having multiple products, layering things on. We don't know what the efficacy is for these individual ingredients. We don't know what the interactions are for these individual products. And not to talk about the expense. I can't fathom that these products are inexpensive, or even if they are, collectively, if they have 10 different things that I'm using, that's not going to be cheap. So, a lot of downsides to having this 10-step skincare regimen. What are some of the benefits that come with the Korean skincare? You mentioned hydration already. Are there other agents that they're usually including to accomplish this glass skin?
Hydration is a big one. Humectants, so they love glycerin and hyaluronic acid, two other big things that we love in American skincare too. Really helps with, helping with reducing transepidermal water loss. Niacinamide is a really big thing that they use in Korean skincare, and that improves that barrier function and really reduces that inflammation. And then they like to use mild exfoliants, and that just really helps smooth the stratum corneum. So they're using things that we use on a regular basis in American skincare, but they seem to be building a good regimen that's creating that glass skin appearance or that smooth, luminous, and reflective skin.
Right. And I know that a lot of these ingredients do have data to back it up, right? We know that niacinamide can be really helpful. We know that soy can be great for hyperpigmentation. But there is probably some kind of glass in the mirrors behind all of this because to have this glass skin, usually you've got to have great lighting. It's not just as simple as you walk out the door and your skin's just shining brightly. Oftentimes, these influencers that have glass skin, they have perfect lighting under the perfect conditions, and they layer on these moisturizers, and you're catching them immediately afterwards. Their skin may not look like that all throughout the day. And not to mention, it's completely normal to have enlarged pores on your skin sometimes and to have some texture to your skin. So I really think it sets these really unrealistic expectations for patients. So while I do love the concept, I don't love what comes with it.
I agree with you wholeheartedly. When I really looked into the research here, the big thing that I took away from Korean skincare is that they are early adapters to really preventing that photo damage. And I think that that's where the big success is.
Right.
Like they're really preventing that sun exposure and the photo damage. And we all know in dermatology that preventing that is what gives you that youthful, beautiful appearance. So it might not be the 7 to 10 steps. It might be that they start wearing sunscreen on a daily basis when they're really young.
Right, and I don't think tanning's quite as prevalent. I think the more fair complexion is really what's looked at, what people strive for oftentimes. And so, like you said, it really is protection from day one as opposed to all these extra skincare products, and then you lay out in the sun to darken your skin. So, any other thoughts about Korean skincare? I don't think it's going anywhere. I think it's increasing in popularity. I would just advise caution for my patients, but anything that you would have to add to that?
No, I mean, the big thing that I tell my patients, and I talk about it a lot, is they don't have randomized control trials that compare Korean skincare to American or
Right.
Western skincare. So it's not that we're seeing that they're so much better than what we're using. And I just stress, if you want to use Korean skincare products, absolutely go for it. I think that they focus on the correct things, but I don't think whether you're using Western skincare or Korean skincare that you need 7 to 10 steps. I think you've got to keep your routines simple and use the ingredients that perform best for your skin.
Absolutely. So moving on to trend number 3. This one I was actually kind of excited about. I had a recent layover in Seoul, South Korea, and I was so disappointed that I did not have a chance to go pick some of this up because I think I bought into it a little bit on social media. But it's PDRN, which is salmon DNA derived from salmon sperm, from my understanding. So can we talk about what this PDRN is Lisa?
I just love that you said that you were excited about it
Very
because when
much.
I heard this trend was coming out, I was like, people are not actually putting salmon sperm on their
I'll
face,
do
but
what it
turns
takes.
out
Listen.
they are.
For great skin, I will do what it takes. So,
So
so will this work? Will it help me?
it turns out it really will. This was a really exciting one for me. So this is DNA fragments derived from salmon, and it's used in injectable and topical formulations. From what I'm reading in the research, I would probably stick to the topical formulations for now.
Right.
But it's very, very popular in those South Korean aesthetic clinics. The proposed mechanism of action is the activation of adenosine A2A receptors, and it promotes tissue repair and angiogenesis. And they have a good amount of data that backs it up. So there's substantial preclinical evidence supporting wound healing and tissue regeneration. And it has emerging but limited clinical trial data for aesthetic applications. So there's data here to show that this stuff works.
So this is impressive. So it's not just a matter of hydrating the skin or exfoliating or moisturizing. We're actually getting some reparative benefits from this topical agent.
Absolutely.
Yeah.
You're getting wound healing, you're getting post-procedure repair, you're lowering healing time, and it really seems to not have any side effects associated with it.
So can you tell me any reason why I should not be using this? Because I'm about to buy some, like today, once we finish this. Is there
I
any
mean,
downsides to using this PDRN?
I wouldn't inject it into anything
Right.
yet. That's the biggest thing that makes me a little bit more nervous, but topically seems to have some data that shows that it could be promising for anti-aging and post-procedure repair.
All right. Well, I mean, I don't know about you, Lisa, but I'm doing it. It was again,
I
it's
mean,
been on my to-do list, and I love my retinol, I love my Botox and everything else that I do, but this might be my next add-on.
it
Salmon
might
sperm.
become part of my three-step routine.
Maybe I'll let you experiment first, and then then I'll see if it
It
works well
sounds
for
like
me.
you're on board even more than I am, so it might be you.
All right. So moving on to trend number 4, which I actually love this trend. So second to PDRN, this is another trend I'm really excited about, is social media education. So while a lot of patients are coming in with misinformation and things that we're having to kind of dispel, many patients are actually coming in very knowledgeable. And I love it. I love, love, love having these conversations, especially my younger patients. I've got 10, 12, 13-year-olds coming in asking me about topical retinoids and skin cleansers and barrier repair, and I think it's really exciting. So what are you seeing in your clinic? What are patients asking you about? What are they coming in educated about?
I couldn't agree more with you. This is a trend that I am so on board with. I think that some dermatologists and derm APPs are becoming social media influencers and putting correct information out there about retinoids, about azelaic acid, and they're really educating patients on the important steps in their skincare routine. I have a 7-year-old daughter, and this has already started in her age bracket of
Really?
they want Sephora, they want products, they can't wait to talk about different products. I push sunscreen, and I just want them to get excited about sunscreen, but I'll pay extra for a sunscreen if it's in pretty packaging that they
Yeah.
wanna put on every
Yes,
day.
absolutely.
Because like we learned with the Korean skincare, if you're protecting from photo aging, you're doing a good job for your patients. So I think this trend is great. I think it's been easier to write retinoids for my younger patients because they understand what they're actually doing and they're getting good education. So I am so on board with this trend. I love this trend. I wish that some of these big dermatologists that are becoming social media influencers would become more popular amongst the young age bracket and the older women, and that they would follow some of these trends more than some of the beef tallow trends that don't necessarily have as much data and research behind them.
Agreed completely. And a lot of the ingredients patients will specifically ask about, as we mentioned already, topical retinoids are really popular, azelaic acid, niacinamide, alpha hydroxy acids, and sunscreen. Patients are coming in sometimes knowing the difference between mineral sunscreens and chemical sunscreens. So, again, I absolutely love it. The one thing I will say that I've run into with patients is sometimes they do too much. They get so excited, they want to try all the ingredients, and they've got a product, again, 15 different products in their skincare routine. They start having irritant dermatitis, and we can't figure out which one is causing what. So I do tell patients to kind of back off. Let's just have a clean break. Let's stick with just the gentle cleanser and moisturizer, and then we can slowly add things on kind of based on your skincare needs. Are you giving any other advice for patients that are maybe running into issues with doing too much?
I do the exact same thing that you do. I say gentle cleanser, good moisturizer. I stress to them that even before I want them to use a retinoid, if they aren't wearing sunscreen every single day, I can't reverse the damage that they're doing with the sun faster than I can help prevent it.
Right.
So, my number one step that I tell every patient is sunscreen, sunscreen, sunscreen. And until you're using sunscreen on a daily basis, I tell my patients, and it's not a joke, I don't walk out of my bathroom without sunscreen
Yep.
on. So, and I reapply and I like it in all forms. I love the powdered stick brushes for reapplication on my face, neck, and hands before I drive home from work. I I stress to them that preventing the sun damage is the most important step, and then I tell them that slowly over their visits with me, I'll add those important ingredients, but that I can promise them that the sun protecting from the sun is the most important step that they can do.
Absolutely. And I do feel like some of my patients, particularly the women of color, need a little bit more convincing. The younger ones who are definitely savvy on social media seem to be with it. But a lot of my older women, I would say 40s, 50s and up, are not really down with the sunscreen. They don't quite understand why they need it. And so whether it's for hyperpigmentation or post-inflammatory pigmentation, I think it's really important to stress the importance. Even though you may not burn, your skin is still at risk if you're not wearing daily sunscreen. So I really try to make sure that they understand that. And I tell them the same thing. I do not leave my house. I don't care what the weather is outside. I have sunscreen on my skin every single day. So
Absolutely.
yeah.
And I have to tell you, I think some of the brands that we see over and over again are doing a better job with like tinted mineral sunscreens so that you aren't getting that white mask across your face. Whether you're Caucasian or your skin of color, the colors are matching the skin tone so much better that you don't look purple after you put it
Yep.
on, or you don't look like Casper the Ghost after you put the sunscreens on. It really makes a big
Yeah,
difference.
and a lot of the big brands too, not just the high end, high expensive products, but a lot of the over the counter simple brands have really, really great quality mineral sunscreens that are tinted that work beautifully. So
Absolutely.
let's talk about our final trend. I would say this one is huge. It's gotten really, really huge the last several months. Red light baths. Do you have one, Lisa?
I do not. Do
Okay.
you?
I do not. I've been debating it, but I have hyperpigmentation. I don't know the science well enough with these red light baths, so I don't want to take the risk that something will go wrong because everything makes me hyperpigment. So that's in my fear. But what are your thoughts and what's the research showing?
So I'm a melasma patient, and while I have had one of these in 900 carts on my internet shopping that I do in the middle of the night, I tend to pull back just because the research shows that it really can work in the wrong direction when it comes to hyperpigmentation or melasma. There actually is pretty good research out there that it can be helpful, but it really kind of depends on how the masks are delivering that red light and how the absorption is happening. So, there is moderate clinical evidence supporting their use for skin rejuvenation. There's improvements in wrinkles, skin texture, collagen synthesis, and there really are just a few limitations. So, when you hear those things, I understand and I want to get on board. But there are things that show that it can affect and make hyperpigmentation and melasma worse. And that makes me nervous in terms of, while I can fix wrinkles, am I going to make pigment worse?
Absolutely. And I think it makes me a little anxious to recommend a product when I can't direct the patient to which one they should get. What's the superior product? Who's done the trials? Are there head to heads? Like, how do we know what we're recommending for patients? So there's a ton of companies, a ton of brands making very, affordable and then very high end products. So I really don't know how to advise my patients against this. So if anyone out there has some really good tips on how to recommend these red light masks, But otherwise, I think for right now, I'm going to take a pause on it and just, get more evidence.
I'm with you. I think there needs to be a little bit more evidence as to which specific wavelengths are the most effective. There's some data coming out about different shapes of these red light masks and how they fit your face, and if some of them are more efficacious. The data's still really limited, so there's not much to put out there yet in terms of if they're all effective. But the data that is out there is that not all red light masks are created equal. And
Hmm.
just because they're more expensive does not mean they're more efficacious.
Right.
So, something to definitely pay attention to. And there are no studies that report specific dose validation for using a specific wavelength on the skin or how long you should be using it on the face. And then the biggest thing that I took away is the American Academy of Dermatology does not support red light therapy at tanning salons, obviously, because we don't look at tanning salons as places that we really want to go to on regular basis. But they're really not telling us specifics as to how to add red light to our daily routine.
Right.
So I'm waiting for a little bit more data to come out before I jump on this bandwagon. And I'd like some really good data on hyperpigmentation and melasma and post-inflammatory hyperpigmentation, because those are things I'm trying to get rid of, not make worse.
100%. I totally agree. So this was wonderful. There's so many trends. We could go on for another half hour discussing some of these, but are there any other kind of, things that you've noticed, Lisa? Anything else that really stands out to you as far as social media and some of the trends that patients are coming in with?
I mean, my biggest one and the biggest thing that I tell patients on a daily basis is that natural does not always mean better. I think we could do an entire podcast on the natural world.
100%.
But those are the really big things. I think these are the top five that I'd love to discuss. I think there will be five new ones in 2027. You never know
Oh,
what
yeah.
the big trends are that are coming out.
And I hope that we trend more towards evidence-based, right? I hope we have more knowledge, more education out there, and we're seeing less of these kind of trendy things that come and go. But Lisa,
Absolutely.
as usual, it was lovely to have you here. I'm so glad we got to do this episode. And I hope everyone listening learned something new, kind of how to educate your patients or counsel them on some of these trends that are out there in social media. But any closing words, Lisa?
No, thank you so much for having me. Let's move on to more clinical evidence-based trends and
Absolutely.
see where we go with skincare.
100%. Thanks for listening, guys.
Thanks for tuning in to SkinSync. Don't forget to subscribe to SkinSync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.